Tell me something. When you think about health, your community's health, your country's health, what do you think determines it? If your answer is doctors, hospitals, medication, genetics, you are not wrong, but you are incomplete. A brief note before we begin. This series is for educational purposes only. It's not medical or clinical advice. It's based on an introduction to global community health psychology applications at the intersection of public health and health psychology, published by Routledge in March 2026. I'm Dr. Anthony Iyore Anaweokhai, MBBS, MBA, MSc, MPH, PhD. Director of the Anaweokhai Institute for Applied Global Health, Port Harcourt, Nigeria. This is Global Community Health Psychology, the full course, Series 1. The evidence now shows us that where you live matters more than your DNA, that social isolation kills as reliably as smoking, that chronic stress writes itself into your cells. That the most powerful health intervention of the last century was removing a pump handle from a street corner in London. Health is not a biological event, it's a social, psychological, cultural, economic, and structural phenomenon. And nobody taught you that. 10 episodes, the foundation of a field that is changing how the world understands and addresses the conditions that determine whether people thrive or suffer. Subscribe, set notifications. The first episode is already waiting. Let us begin.